is Robert Parkinson. I'm the Director of Patient Care. My job is to make sure that the patients are receiving the care that they were promised. What makes Beach House different is that the whole concept of the approach that we're taking in terms of loving the patients to health, treating them with respect versus them coming in just as another number, just another client. We kind of make them feel special. A lot of people that come to us they come in so beat up, and they don't need to be beaten up anymore. What they need to be is to show how to love, to respect them, that they are somebody, that they're good people, they just have a really bad disease, and they got to understand that. I come here early every morning, and I get with almost every patient and sit down with them and talk to them. And I talk to them about their life. It doesn't always have to be recovery, something they're interested in, something that excites them, a little about who they are. And by doing that, it gets me closer to them. So when they are having a problem and they know that I'm there to help them, they know that I really do want to help them, that I took time to get to know them. I love it because they're interesting people. There's a lot of experiences, they're much more than just their addiction. Their addiction shouldn't define them, that there's other characteristics that we want to bring out of them to define them. And that's one thing about people in recovery is about, we're not our addiction. We're more than that. When they come in here, that's how they're identified. It's how people label them. It's the problems, everyone tells them that. And so part of us here is to move them away from them. Yes, they have the disease. Yes, it will kill them if they don't stop. But they also have to be able to take on another identity for the good things in them, the positive aspects in them. People get sober, so we're identified by many things, not just by one thing. In our addiction, it's one thing. It's our drugs, our alcohol. But people in recovery, they'll tell you, they're defined by many other things. Getting to know what they like, their family, their interests. It kind of helps me to get them to bring that out and to see, really to see what they do have, and that, they have things worth getting better for. I believe that when addicts find something they love more than the drug, they're going to want to get better.